The last part of the hands-on work I like to do is, and that is identifying where the interface restrictions are for thoracic outlet syndrome. So simply put, what that means is the brachial plexus comes along its path. It obviously has to go and move through tunnels. Now those tunnels are created by muscles. Now those muscles can get tight, which makes basically that those tunnels then start to interfere with the nerves and their ability to move through that area. So from our point of view, I know all of you out there, thoracic outlet syndrome, like I said, yes, we've got entrapment sites here, but we've also got entrapment sites down through the arm. They are often missed. So how we assess those is by putting the nerve on a stretch and then identifying where the restrictions are. So it's actually quite simple. So we're going to use what we call a neurodynamic test, and basically what we do there is we're just putting the nerve on a stretch and then we're finding out where they feel it, and then we treat that area. And that's how we work through these interface restrictions. Okay, so I'm going to use a median nerve base because that's probably the most common we find in thoracic outlet syndrome. All right, so this is how it works. A little bit of lateral flexion. Ali goes in lateral flexion of the neck. I then come down with my elbow, depress the shoulder, bring the arm and the shoulder into external rotation. I then wrist into extension and then elbow into extension. Now I go as far as I can until they start to feel a stretch. Now that could be up here, it could be down there, it could be in the hand, it could also be up there. But for Ali, you're feeling it in the elbow, so the median part of the elbow. Okay, so from a treatment point of view, that basically means that's where I'm going to treat. So identify the area where she feels it. So we're looking at flexor carpi ulnaris. Okay, so that's the area that we're going to treat. Now, interesting because that's where the ulnar nerve comes through as well. Okay, the median nerve is obviously coming down this way, the radial nerve traps around that way. Okay, so sometimes it can be either one of those, but it is not uncommon that the elbow is the first place that you tend to see some of these interface restrictions. Okay, so we can simply just do some soft tissue work through this area. Now, this is actually really quite specific, this work, because what we do is we trial treat and then we take them back into that neurodynamic stretch and we see basically where it's offloaded, then they might feel it somewhere else. So we're basically just chasing wherever that interface is, and we do that until we can get a fairly good range of movement through that median nerve. And then just every now and then we can start to do some cupping as well, so especially through these forearm flexors.